Good day, and welcome to another HIMSS TV Digital Checkup. I'm Bill Sawicki, Features Editor of Healthcare IT News, a HIMSS Media publication. Today, we'll be talking about the role of digital therapeutics in non-visit-based care and participatory medicine, and where they can be improved. My guest is Dr. Danny Sands, Chief Medical Officer at Medisafe, a medication management platform company. Welcome, Danny.
Thanks, great to be here, Bill.
I have a few questions for you today. Let's jump right in. First, you are passionate about non-visit-based care and participatory medicine. Please talk a bit about these forms of care and why you feel they are important.
Sure, Bill. So first of all, let me talk about non-visit-based care. And by the way, these aren't mutually exclusive. These are different models. So non-visit-based care is care that doesn't take place in the office. It's very simple. I think that although I've been promoting this for such a long time, we've seen through this COVID pandemic how we were able to transition to telemedicine, right, as an example of non-visit-based care. And much to everybody's surprise, except mine and other people who've been promoting this for a long time, we've found out how useful it can be for patient care, how powerful it can be to take care of patients using this technology, even without seeing people in the office, how it has empowered patients to be able to seek care when it's otherwise hard for them to get out of the house. So it's really quite potent. And in fact, if we think broadly about this, there are a lot of things we can do without bringing patients into the office outside of telemedicine. Telemedicine, of course, is often described as technology like we're using today, where we're using video and along with the audio, and it's real time and it requires scheduling. But in fact, there are asynchronous technologies that are useful too for non-visit-based care. And that's everything from sending images to using electronic messaging like email. All these things can be useful for non-visit-based care. And in fact, there are even automated tools that can augment this, which can be very exciting as well. That's non-visit-based care, very powerful. And what we need to do is we need to be thinking broadly about healthcare, about taking care of a population of patients. And we need to think about all the tools we can apply to that so that we can effectively scale our limited healthcare resources. Participatory medicine is a collaborative model of care in which we think about patients and healthcare professionals being collaborators in healthcare, rather than one talking over the other, or one person ordering things, the other person is not involved. There are a lot of elements to that, but the idea is that in a participatory relationship, we can think about healthcare more as a collaboration between the healthcare professional and the patient, as opposed to what I like to call the car wash model of healthcare, where the healthcare system is the car wash and the patient is the car, and the patient is unhealthy, the car is dirty, and the patient passively cruises through a healthcare system and gets health sprinkled on them and somehow comes out the other side healthy. Well, that's not a model of care that works. And that's why we have an expensive healthcare system that is not personalized and it is not producing the outcomes that we need. And just full disclaimer, I am one of the founders of the Society for Participatory Medicine, and I'm currently the Chief Advocacy Officer.
For those who might not know, I was hoping you can go into digital therapeutics a little bit, what they are and where they fit in with non-visit-based care and participatory medicine.
Sure. So I'm gonna crib from the Digital Therapeutics Alliance, and I'm not connected to that organization anyway, but they actually have put together some wonderful materials to describe what this is, because it's kind of been a wild west. Everybody's calling themselves digital therapeutics. And what they say is that digital therapeutics deliver evidence-based therapeutic interventions that are driven by high-quality software programs to prevent, manage, or treat a medical disorder or a disease. So that's a really nice, concise definition of what we're talking about. And if you parse that out, you say, okay, wow, it's evidence-based, it's therapeutic, it's high quality, and we're preventing, managing, or treating conditions. So that's really what it's all about. And I think that the way this fits in is that if you look at digital therapeutics, first of all, this is another channel of taking care of patients. So we talked about email as a channel, we talked about telemedicine as a channel, but we can actually spin off these digital therapeutics and have technologies, maybe augmented by people as well, that interact with the patients, coach them, encourage them, and gather data and even interpret that for them to help them achieve better outcomes or prevent illness. And that's really how that fits in with non-visit-based care. It's yet another tool in our armamentarium. And with respect to participatory healthcare, we are actually engaging patients in their healthcare. Digital therapeutics does not work if it's just thrust upon the patients. The patients need to be a part of this. And that's where we get good outcomes with some of these digital therapeutics, is when the patient is really engaging and participating, and ideally when they're even involved in the decision-making around whether or not to start a digital therapeutics program.
My final question for you today, I'm wondering, where do digital therapeutics need to improve to better engage patients?
So that's a really interesting question, and I'll answer that in a number of different ways. And some of them really harken back to what is digital therapeutics? What is the definition that was given by the Digital Therapeutics Alliance? So first of all, let's solve a real health problem. And what I mean by that is we're solving a problem that exists. We're not solving an imaginary problem. We're not doing something just so we can push more medication. We need to be solving a real problem. As I mentioned a little bit ago, we need to be engaging patients in whether or not to embark on this digital therapeutics in the first place, and then we need to be supporting them along the way. And I think that that's important, because when a patient is doing something that touches technology, they're going to run into problems. They're going to not have maybe it's a bandwidth problem. Maybe it's a problem with the application or the website. Whatever it is, we need to make sure to support them along the way. And related to that is we need to meet patients where they are. So not all patients are as tech savvy as you or as I, perhaps. And so everyone is different. Everybody comes to this differently. Not everybody who has diabetes has a Bluetooth-enabled glucometer, for example. Right? So what do? Not everybody has good bandwidth in their home. So we need to figure out systems that really help patients who come from all different backgrounds. As we're developing these interventions, I think it's very important that companies and institutions that are developing these things need to work with patients to understand their perspectives, their lives, their workflows. That becomes very important, because then we're developing something that really meets a patient need. And by the way, when you're bringing patients into this, don't just hit them up for information and then leave them. Pay them something for that. These are professionals as well. Maybe they're professional patients, whatever. This is their lives, and we shouldn't just pay someone like me for advice and not pay patients. Next, we need to be publishing the results in the peer-reviewed literature. That's actually something that the DTA outlines as well. And then you need to feedback and integrate the data and all the stuff that's happening with the physician's data and the physician's workload. And I'm not saying that's an easy thing to do, but if physicians are part of this, then they're going to be promoting their patients' involvement in this. They're going to be prescribing digital therapeutics to the patients. And finally, I would suggest, because I know I've looked over this pretty carefully, the DTA has published best practices for the use of digital therapeutics, the development of digital therapeutics, and I think they're really good. I think they hit many of the high notes that we need to be doing. So I think that in summary, I think there are a lot of by the way, there are a lot of interesting companies that are doing digital therapeutics or pieces of the digital therapeutics equation. And I think that, hopefully we'll see more and more as we appreciate the fact that in order to take care of populations of patients, we need a lot of tools at our disposal. And digital therapeutics, I think, is one of those tools.
Yes, they're fantastic. Well, that's today's digital checkup. I'd like to thank my guest, Dr. Danny Sands, the Chief Medical Officer at Medisafe. Thank you, Danny.
Thank you.
And for all of our HIMSS TV viewers, stay tuned for another digital checkup coming soon.